My name is Vikram Patel.
I'm Solon Mathur.
It's Chris Fairburn.
I'm Daniel Mitchelson.
I'm Patty Gonsalves.
My name is Bruce Chorpita.
I'm Ria.
I'm Kanika Malik.
I'm Pooja.
My name is Ria Matthews.
मेरा नाम ज्योति है.
मेरा नाम अनुज्ञा है.
My name is Shweta.
My name is Elena.
I'm James CJ, working with Pride.
I'm Abhija.
Hi, I'm Abhijit.
My name is Vidya.
My name is Mamta Verma.
मेरा नाम केशव है.
I'm Meenakshi.
My name is Ruxan.
Hi, my name is Sarita.
I'm Shoaib Ahmed.
I'm Tejasvi.
Pride is one of the most ambitious programs that has sought to address mental health problems in young people in India through a combination of a suite of research studies and public engagement efforts to reach young people across the country. The impact that Pride has had can be measured not only in terms of the many interventions it has developed and evaluated for delivery in school settings and on digital platforms, but also the impact it has had on the careers of the many young people who worked in the program and the many more young people who have been reached by our extensive public engagement efforts.
Pride is very important. It addresses a key issue in mental health, and that is the emergence of mental health problems during adolescence. This is when most mental health problems develop, and this is when we should intervene.
It was a really excellent illustration of how to design an intervention for a particular context, taking into account the various constraints with that context.
The thing that I will take away most from working on Pride was the value and challenge of trying to integrate what we know from international research with the expertise, knowledge, constraints and opportunities of local context in Delhi and Goa.
The most important for me has been the gap in adolescent mental health care in India, for which our suite of interventions I feel has been able to address successfully, and what it needs now is to be scaled up.
The one thing that Pride has taught me is how to actually train lay counsellors in delivering a mental health intervention and realizing that it actually does support adolescent mental health. This has larger implications, of course, for reducing the care gap between the demand and supply of mental health services.
The Pride Research Program helped me better understand common adolescent mental health concerns and the detail of a mental health intervention that is specifically designed for adolescents.
My one takeaway from the program was to see the impact that the problem-solving intervention had on young people's mental health in schools.
I was always surprised by how open these communities are in terms of help seeking and how invaluable they made you feel, even for your very brief inputs, a small token of support.
Our stories have immense potential, not only to help us find ways and articulate how we can support ourselves when we may be struggling, but also to share hope with many others.
The most important thing that I learned in the program was to start with POD itself. Apart from that, I got to work with many interesting people with great work ethics and practices.
One thing that's really stood out is how to plan and innovate a mental health intervention, keeping in mind the current scenario, like for example, like pandemic.
Pride, the project in the last 4 years, I think I've been able to meet some amazing people who really helped with my understanding of mental health and how far we can actually take it.
मैंने प्राइड में सीखा कि मेंटल हेल्थ क्यों ज़रूरी है.
प्राइड ने मुझे सिखाया कि रिस्की सिचुएशन को किस तरीके से मैनेज किया जाए और फ्यूचर में आने वाली प्रॉब्लम्स को किस तरीके से मैनेज किया जाए.
प्राइड का पार्ट होने से मैंने ये सीखा कि एडोलेसेंट पॉपुलेशन की मेंटल हेल्थ पे फोकस करना और उसे सुधारना कितना ज़रूरी है, और एक नया क्रिएटिव थॉट प्रोसेस डेवलप किया जो आगे इंटरवेंशंस और टेक्निक को बनाने में हेल्प करेगा ताकि एडोलेसेंट्स की मेंटल हेल्थ और बेहतर हो सके.
प्राइड से मुझे टीम स्पिरिट सीखने को मिला है एंड मेंटल हेल्थ स्कूल एंड ग्राउंड लेवल पे कितना इम्पोर्टेंट है ये पता चला है.
प्राइड एक काफ़ी इम्पोर्टेंट प्लेटफॉर्म है यंग जनरेशन के लिए एज मेंटल हेल्थ के अंदर, और इससे मुझे काफ़ी सीखने को मिला यहाँ पर और मेंटल हेल्थ के बारे में.
Pride for me has been a really good experience because working with kids are something different what we have learned.
My experience with Pride has been enriching, and I feel it has really been a very good experience.
Through the Pride project, Sangath took a few more steps towards its mission of making mental health care accessible to all. I'm very proud to be a part of this project that empowered young people to take charge of their own mental well-being.
The fact that we've had the opportunity over 6 or 7 years to do very intensive and I think thoughtful developmental work, to do very extensive piloting, and then for some of the interventions at least to do very high quality trials. I think seeing that work through over a period of time, doing it so systematically has been very important, I think.
Pride transformed how I understand mental health for adolescents, and I realized there is a role and a space for so many people to work together. Young people themselves, their parents, teachers, schools, counsellors, mental health care workers, and policymakers.
The one word that comes to my mind when I think of this program is enormous pride.
Meaningful.
Inspiring. Scalable.
Intuitive.
Ambitious.
Collaborative. Methodical.
Crisis mitigation.
Skillful.
Problem solving.
Innovative.
Fun, learning and great experience.
Teaching inspires change.
Relevant.
Excellent.
Dynamic.
Everyone who has worked on Pride, whatever their role, you should be proud of Pride.